Okay, Jennifer, I call this meeting to order, and would you please do a roll call, Jennifer?
Ms. Bernstein, Ms. Krisham,
Here.
Mr. Globinger, Jay, Mr. Globinger.
He's muted. He's here.
Oh, I see him. I'm just gonna mark you as here. Mr. Parsi,
Here.
Ms. Shu, Ms. Young,
Here.
Mr. Fromm.
Here. Anna, you're sideways. I need to ask everybody if you're agreeing with the consent agenda, and if so, could somebody make a motion, please?
I'll second.
Who moved?
That was Mara.
Okay, Maura, thank you. And who
I have
seconded?
a comment on the agenda.
Please.
There was an Economic Development Committee meeting on July 8th, which is not reflected on the agenda. I would be willing to make a report if you would add it to the agenda.
It will be added after the public comments. Thank you, Jay. Appreciate it. Okay, Maura made the motion. Who seconded? Who seconded the motion?
I actually, two of us moved and then I seconded it. So
So who was the one that moved?
Abby.
Okay, Abby,
No,
thank
no, I didn't.
Oh, you
no,
didn't?
no, you guys, I didn't.
Oh.
I can do it, but I never said anything.
you. Okay, will somebody make a motion to approve the consent agenda, please?
I'll make a motion to approve the consent agenda, for real.
Thank you.
and I will
Maura,
second that motion.
Thank you. Roll call, please, Jennifer.
Ms. Krisham,
Yes.
Mr. Globinger,
Yes.
Mr. Parsi,
Yes.
Ms. Shu, Ms. Young,
Yes.
I cannot hear Jamie.
I can't hear Jamie either.
Yes. Can you hear me?
I can hear you now, Jamie.
Yeah.
Now we hear you.
Mr. Fromm.
Yes, the motion carries. Public comments. Are there any comments, Brody? No comments. Thank you very much. Jay, could you please give us a report on the Economic Committee meeting or commission?
Sure. So the meeting was July 8th, so a little over a week ago. It was virtual, and it focused primarily on COVID issues, with most of the board, primarily the school boards, talking about how they've had to adapt in terms of some of their processes and activities due to the COVID crisis. There was a little bit of discussion about some of the ongoing village issues. The village right now has had a significant change in their tax base. With Northbrook Court being primarily closed for several months, there's a significant loss of sales tax revenue. There have been changes that the village had to consider, and things like outdoor dining and those issues. The hotel taxes for the past several months have been non-existent because the hotels are not having any guests in them. All these are affecting budgetary issues primarily for the village because they have sources other than property taxes. In case anybody didn't know, the village has initiated a Northbrook Strong grant program with grants available for up to about $2,000 each. There were 33 applicants for the grants with about $250,000 available. It's coming out of the village's budget, not out of other sources. And right now there are fewer grant applicants and there are money available, so there's still money available if anyone knows a business in the area who is interested in applying. On the different issues being faced by the boards, the schools talk primarily about what they're doing right now to address the upcoming school year. All the schools have had to have significant time to try and figure out how to have in-person activities. All the schools, initially at least right now, are focused on trying to have in-person activities, depending upon what happens between now and the start of school with the COVID scenarios. They talk generally about things like having to do some surveys of their kids, parents, and the like to determine how many are actually going to be coming in person if that's the option chosen. How many would refuse to come in person and would instead participate virtually. And then all of them talked about having to re-enroll students at the end of this month in order to have accurate counts. They're all having to do things like determine physically space, how many students can fit within a room, how many classes are going to be needed for each grade, and then how many teachers are available. And so they've been reassigning staff, changing some activities, changing schedules, reassigning rooms, all of which has to be done in a short period of time in order to get up and ready for the new school year. And they also talked about things like having difficulty trying to interpret the state's guidance when the state uses terms like socially distancing as much as possible, things I'm sure that Kate can relate to, having had to go through it for the library, trying to figure out some of the more ambiguous state guidances or federal guidances. All talked about needing to be flexible because even with the best of plans, if the COVID situation changes and the cases continue going up, those plans may have to be scrapped and changed at the last minute. Or if the state goes backwards in terms of the phases, then they may have to reassess. Kate made her presentation on behalf of the library talking about the changes we're implementing as we move to phase 4. She talked about how online services have increased dramatically for the library. She talked about quarantining materials as they've been coming in. And she also talked about implementing curbside services, and once the building's open, how the building will be limited in terms of what patrons are able to do within the library. The Northbrook Bank and Trust talked about how banks are gradually starting to reopen again, but it's taking time. They've talked about how they're expecting a lot of loan defaults, which I think may be something that's of an issue for a library, because with loan defaults and mortgages comes issues with people paying property taxes, and potentially are seeing our property tax revenue being impacted if there are a high number of failures to pay property taxes as we start seeing the second installment coming in the next 2 months. On recent development within the village, Northbrook Court is still moving forward with their construction. Fresh Farms is apparently the grocer that's going to be moving in the grocery area. The multifamily portion of Northbrook Court is still up in the air. They have not received a proposal as to who the new contractor will be, and it appears that's going to be delayed somewhat because of the change in the contractor for the multifamily. For Green Acres, the village said they're expecting a presentation of a new development plan from a new developer in the next month or two.
You said new developer?
They haven't announced who it is, but they're supposed to be a new developer, yes. And the village has yet to decide what to do with the Granger property. So those were the highlights.
I'll open to this for discussion. Anybody has any comments, questions, please? Okay. Kate, would you please follow with your staff report?
Sure. I don't really have too much other than what was in my report. We do have summer reading that has started, and our theme this year is Dig Deeper, Read, Investigate, and Discover. It started on July 1st. We have programs for kids, teens, and adults. Everything is online this year, and all prizes will be mailed out. You guys saw the presentation last month from Kelly. I would encourage the board members to sign up. You can do it at our website, and encourage others that you know to sign up as well. I also wanted to just touch base about the board portal, which we launched this month. I know some people maybe had difficulty getting access, and I just wanted to touch base and see who is having trouble so that we can follow up with you individually. Maura and Jay and Abby.
And I've already followed up with Brody.
And you've already followed up with Brody. Was everyone then, so then Carlos and Jamie, were you guys able to get on?
No, could you please send instructions again to all members, including those that are not here today, We need to have all on the same page and everybody educated the same way and informed the same way. So we cannot go back to Brody individually. That would be too time consuming. Go ahead, Abby.
Brody, I got a 404 error, so to Carlos's point, I think that would probably impact everybody. I don't know if that's the same error everyone else got.
Yeah, that's what I
Yeah,
got.
that's what I'm getting to.
Okay, so it's
You're still
more of a
seeing-
back-end thing
And you're still
than an
seeing that?
individual issue.
You're still seeing the 404?
Yes,
Okay.
Mhm. Yeah,
Just
I
letting
just
you
tried
know.
it again this afternoon.
same here.
I
I just
think
tried it
that-
a few minutes ago.
Yeah, you should try it and then call somebody out of the library and ask them to reach that place and see, and then troubleshoot that way. Don't bother the trustees until we have something critical, you know. Okay, Kate, go ahead.
That was all I had for my report, unless anyone had any questions on anything in my written report.
No, we're probably gonna hear from you on the next discussion. So let's go ahead with the unfinished business construction projects updates. Anna, I guess you're involved in that
Yeah,
a little bit.
yeah, a little bit. So boiler ventilation project, they hit a little snafu, but they're working with the motor vendor and the control vendor, Siemens, to work it all out. They're hopefully going to get a resolution soon. Exterior facade, all of the painting, interior and exterior, is complete.
Good.
They are now going to be working on the metal panels on the east side of the building. They just found a vendor that they can get those supplies from, and they're going to be working on that. And the study room project, we did a punch list with the architects this week. So the contractors are going to come in and clean up those punch list items. We are waiting for KI to come in and install the door on the large study room, but that should be done next week as well. So all of those projects are almost complete.
Kate, you want to add something to this report?
Just that now that the exterior facade is nearly complete, we will be bringing people in to do the photography so that we can do the before and after. So as soon as that's done, we'll share it with the board.
Yeah, Wiss Janie is working on that.
Mhm.
They're putting that together.
I guess that the issue with the boiler is that one side is pointing to the motor and the other side is pointing to the controls, and usually that's the case in those situations. Kate, are there any comments, discussions on those items? You want to wait until we finish with all those? Okay, Kate, why don't you go on the reopening plan update?
So we have a lot going on. We are getting ready to open on Monday, July 20th. We will have reduced hours. The library will be open Monday, Thursday, and Friday from 9 to 5, Tuesday and Wednesday from 9 to 8, 11 to 4 on Saturdays, and 1 to 5 on Sundays. So it's 40 hours compared to the 69 we used to be open. When people come into the building, they're going to experience a very different library than the one that they left in March. We have large portions of the library closed off to people. We will only have one entrance open. That'll be the east entrance. We're using the other entrance to kind of stage for curbside pickup, and we also need to count the number of people coming in. And that was going to be just very challenging with the two entrances to really keep track of people. So we are then going to have our computers available and our study rooms available and appointments in the collaboratory. Everything is by appointment only for those 3 services, and they have to make the appointment ahead of time. There will be no walk-ins. I've read through all of the DCEO guidelines. Unfortunately, there were no written guidelines for the state specifically for libraries. And so we had to kind of cobble together stuff from 7 other guidelines. So we have stuff from, I'm sorry. So we have things like meetings and social events, recreation activities, office space, retail, because we do have kind of like the shop feel. So we looked at all of those to put together the guidelines. I've asked the state library if they would provide some guidelines, and they've said that they will not be providing any in the near future, but that may be someday. So
Has any state done that?
I have not checked all 49 other states, I'll be honest. But there hasn't been anything on any of my listservs or anything else that I have heard or seen. It's very challenging because people are like, well, they're libraries. No one goes to libraries. And we're like, we actually have a ton of people and we want to be safe. So what we're doing to be safe is we're enacting pretty strict cleaning protocols. We're going to have people cleaning throughout the day. We're going to be cleaning every study room and every computer, all the tables and equipment in the collaboratory after each use. The youth services department will be completely closed off. And people will be able to go up to a desk at the entrance to youth and request materials, which we'll run and grab for them. So there won't be any games or iPads or craft table. We've removed all the seating from the library because we don't want people hanging out here. So they have to come in wearing a mask. They have to leave the mask on the entire time and leave. Thanks to a generous donation from the Chinese American Community Society that just formed recently, is my understanding. Jamie, correct me if I'm wrong. Yeah, they donated 750 disposable masks. So we'll be starting with those to give those out to people that come in without a mask. So we're very grateful to them. We will be limiting the number of people in the building to 50. And we'll be counting to ensure that we don't exceed that capacity. One of the major challenges with all of this is having enough staff in the building to do the work that needs to be done and cover the desks. As you know, we had a staff member that tested positive a few weeks ago. And one of the challenge moving forward with all of this, and I think the schools and Park District are experiencing this as well, is that when you have one person test positive, it's not just one person that you're down. It's every person that they were working with and in contact with, and they have to quarantine for 14 days. So as this continues to go on and as there's more positivity, more positive cases, there may come a time when we may not be able to have the library remain open simply because we have to have so many staff quarantining at home. So we're working on figuring out what that number is and what we would need and what core services, like if we can just only offer curbside, how many people do we need? So we're figuring all of that out, but I anticipate that that is going to continue to become a larger and larger issue the longer this goes on. And that is certainly a challenge. All staff have completed 2 rounds of safety training. We also are doing employee health screenings every morning so that anyone that is symptomatic has to remain home. We've been talking to the Illinois Department of Public Health a lot. Unfortunately, the Cook County Department of Public Health is not really offering any guidance. So we're calling IDPH a lot to just make sure we're following the proper protocols because they have been changing pretty rapidly. I know the board asked, I think it was 2 meetings ago, about whether or not we could regularly have staff be tested. And so I did reach out. North Shore University Healthcare System just started a new employer generated screening program where they will do tests for employers on their employees at the Old Orchard location. Unfortunately, the tests are $100 per employee per test. And so if we were to say, for instance, do all of our staff every week, we'd be talking about a significant amount of money, which I don't feel at this time would be a good use of taxpayer dollars. But of course, if the board would like me to continue looking into that, I'm happy to do so. And if the price comes down, we certainly can consider that. It isn't just the cost for the $100. There's also that we would have to pay staff to go there. So we'd have to pay mileage as well as the time spent there doing the test as well. So I do think that it is something that we should continue looking at, but it is something that right now I don't think is very feasible. I feel pretty strongly that we have good safety protocols in place so that we are being alerted by staff when they are showing symptoms, and we are encouraging them to go get tested. So I do feel like we're taking all reasonable precautions right now to keep our staff safe and to keep the building safe for patrons. We will also, I should mention, I forgot to mention this, it's in my notes. We'll have 3 hours a week that we're open for vulnerable populations, and we're defining those as people that are either medically vulnerable or have self-identified as being part of a vulnerable population. So we're not going to be like quizzing people as they come in, but every Monday and Thursday from 9 to 10 and Saturdays from 11 to noon, we'll have the building open for those populations as well. So now that I've just thrown a ton of information at you, I'm going to take a breath and see if you have any questions you'd like to ask me about the reopening.
Maura and then Jay.
I have a couple of questions. One is, how are you communicating this to people? There seems to be such sort of, and misdirected, but people are so frustrated, I think, with everyone, not just the library. I'm wondering how it's going to be communicated so that everyone can kind of digest the information before it.
Yeah, and we sent out an email last week just talking about safety, but not giving people a lot of details, because what we have discovered over the past 4 months is if we give them too many details too early, and then if we have to change anything, people get really upset.
Okay.
And so we'll have an email that's going out to all 11,000 people that are part of our email listserv tomorrow. And that will include all of the details that I shared with you, as well as how to do the things, like how do I register for a computer or to use the collaboratory? How can I pick up my hold? We have a page that we've created on the website, which will go live tomorrow, that details all the information related to phase 4. It is challenging because there's every single organization and business and has their own rules. So people get frustrated, right? So we know this, and we've given staff talking points so that they can answer frequently asked questions easily over the phone. We get email questions. We also have a lot of signage up in the building. So we have physical barriers for all of the places that are, Sharon, physical barriers for all the parts of the library that are closed off with big signs saying no entry. We have a video that Kathleen Doyle, our Maker Services Manager, is making that takes people on a tour of the library. It's just a few minutes long, and we'll show them like what they can experience, what they can expect to experience when they come in. We'll also be doing short snippets of that video, putting them on the website. So if people want to like, how do I come in and use a computer? We'll take them just through that. And then we'll have a longer one to show them all of the different experiences. We're also putting information up on social media, and then just general signage. And then of course, just staff in the building. I plan to be down in the lobby for the first few hours each day next week so that I'm there to help answer questions and do different things. We obviously will have staff at all of the service desks. Brody, is there anything I've forgotten that we're doing?
No, Jay had a question.
That's about it.
Okay.
Jay?
Is Mara done? Because I thought she had several.
I had, my second was just about the testing, and that because the testing is taking so long to get results back, it doesn't seem to make any sense to kind of just to test people who aren't showing symptoms, I would say at this point, but other people can probably speak more eloquently about that.
And I would also say that one of the things we've experienced with North Shore is that staff that have gotten tested there have typically been getting their results back in 2 days.
Oh, okay.
So, which is great. But I don't know, Kehan,
Okay.
if you have any.
Yeah, no, I mean, it really depends. I've heard some people taking as long as a week. But if people are asymptomatic, yeah, I don't see any, as long as people are masking and distancing, I don't see any reason everyone should be tested.
Jay?
So Kate, my question was about your comments on how the program may change if we start having a significant number of staff who are testing positive and having to be quarantined. Because right now we have the, I guess, the benefit of having the summer weather and being able to do things like curbside pickup outside. And so as the weather changes and we move into fall and winter, which I think we're presuming that we're going to have to continue along this path for a while, have you started considering also how with the weather changes, how some of the services will change? It doesn't seem like curbside pickup will remain viable, in December.
We would have to change kind of how we're doing curbside during that time, possibly using the lobby, like the vestibules, or possibly doing deliveries to people's cars. One of the reasons that we set up curbside the way we did right now is because people were getting out of their cars and trying to talk with staff when they were doing returns. I'm pretty sure in December that we wouldn't have an issue with people with opening someone's trunk and putting in something in their trunk and having them want to come out and chat with us. So I think we could do like, a runner service, but we'll be talking with Circ about that to figure out what we need to do. We're assuming curbside is kind of a thing that's here to stay, not just during this, but that this will be a service that people are going to want after. So we knew that going in and made plans to ensure that it would be a continuous service.
Sure, but when we had the construction and, the first floor was open, I just think back about how staff had issues with the temperature and the conditions, and acknowledging that curbside is probably gonna have to be around for a while. I'd be concerned about making sure that staff have appropriate
Gear.
right, for dealing with the curbside. And
Absolutely.
that, if we need to, we get the gear so that they don't have to worry about providing it.
And we do that for maintenance staff already. We provide them with winter gear for when they're out doing maintenance, snow shoveling, salting, etc. during the winter months. And we would do that for the other staff. We've also looked at whether or not we could rent or purchase exterior lockers. And so far we haven't had great luck finding a good solution for that, but that's another option as well, where staff would stuff the lockers. I know we had them many years ago and they were never used. I think we're in a different time now, so they might be more used now, but I don't know. But we've explored that. We kind of tabled it for right now, but that's certainly something we can look at again.
Okay. And the other comment I had, Kate, was reading through the patron comments. It seemed like there was a lot of negative feedback in terms of the plan. And so I'm going to guess you're probably going to continue hearing negative feedback as the reopening occurs.
Absolutely.
And so I just hope you'll let the staff know that the board is in support of the plan and, to do their best to bear with it.
Thank you. I will certainly pass that on to staff.
Just blame it on us. Kehan, you had a question?
Yeah, just a couple quick questions. So Kate, you said that when you open up, the capacity will be limited to 50, right? How does that contrast to what is a typical number of people? I mean, is that a quarter or a third of what you would typically have? More probably like 20, maybe 25%. What we looked at, and looking at all of the door count data, what we discovered was that we're pretty consistent throughout most of the day. We don't have spikes. It's not like, oh, the morning is super busy. It's like we're pretty steadily busy through the whole day. Where we do see spikes are when we have large programs. So like our Wednesday afternoon movies. And when you start removing all of the people from the, from the programming, so like story time, movies, concerts, we start to see things pretty level out. I'm hoping that by limiting it to 50, we won't ever reach that capacity, that we'll end up getting around 40 people in at any given moment. So a typical day pre-COVID in the summer, we were looking at probably around 1,700 people in each day. I'm expecting only a couple hundred people in for the whole day for like a 9 to 5 day now. So I'm thinking that we're going to be seeing like an 80% reduction in people in the building. It's not like a hard and fast thing. Like I had to kind of manipulate some of the data because it's not perfect and we can't account for every program, but that's my guess based on the analysis I've done.
Yeah. And then clarify again, you said which stacks are going to be closed off to?
Oh, sure. So up on the 3rd floor, all of our AV materials will be closed. All of the fiction on the other side of the desk will be open. And the reason we're closing the AV stacks is because children like to put things in their mouths and touch stuff, and I mean, frankly, so do adults, but we're focusing on the children right now. So because we have children's collections on that side, we thought it was important to keep those closed. Also the CDs, you have to go like this with them, so you're touching everything. And we didn't think that was a great idea until we got more results back from the Realm project. On the 2nd floor, all of our adult nonfiction will be open. Magazines and newspapers will be closed, and all of children's will be closed.
Do you expect to get a lot of pushback on the children's area being closed, or?
We do, but we also feel like it is the safest thing.
Oh, I agree.
We're encouraging people just to not bring their kids in, which breaks our heart. I mean, I used to be a children's librarian, so like it makes me super sad, but I think it's more important for people to be safe right now.
Right.
Like we can still offer good customer service, but we're not going to put that ahead of safety.
Any other comments? Go ahead.
I saw the face shields that you guys are printing, and it said that you have them available for staff as well. So is that like if they want to wear it, they can? There was just a report on how those are actually also very effective, and combined with the mask, they're extremely effective. I'm sure Kahan could comment further, but I thought that was great that you're making them available, and I guess it would be optional for them, right?
Yeah, and we also have goggles if they don't want to wear the face shield. And then we also have plexiglass barriers at each of the desks. But then if someone is out, like if our shelvers are out shelving, they can wear that and add an extra layer of protection.
Are those reusable? I don't actually know. Can you reuse them?
You can just clean them. You can spray them or take a wipe and wipe them down and reuse them. And each staff member has their own, so they're not sharing. So like my face shield is my face shield. I don't have to share it with Brody.
You take it home. This is probably not an issue given how many people are in the library, but I was actually wondering about the elevator. Is there like any kind of sign, like one person per elevator or one group or something?
We say one household at a time in the elevator, recognizing that we might have families coming in and that's okay. But yes, we have it posted in 2 spots on each elevator.
We've gone one better. We've have it 2 signs.
Let's hope. I can't imagine someone jumping in the elevator with a stranger, but you never know.
Oh, we are, not that we would place bets, but hypothetically, if we were to be wagering how soon a patron would try to get past the no entry signs in different areas, we're guessing it'll happen the first day. Yeah.
Okay, any other comments?
I feel like Maura had a 3rd question that we didn't get to.
I don't know if this is the right time. It was about the comment about, because this isn't really about the reopening, it was about the racial awareness and racial equality comment.
Oh, so maybe wait till then.
Yeah, we can
We'll
wait.
work on that later.
Yeah.
Regarding the test, you said that if somebody has some symptoms that you ask them to go and get tested, we pay for that, am I right?
No.
We should. If you ask somebody to go and test,
there's no cost. There's no cost to get tested. Testing is free. I mean, the federal government is paying, right? But we are not paying anything.
then what was the test cost at the North Shore you were talking about?
It's because if we are telling them as an asymptomatic person that every week they have to go get tested, and we as their employer.
So these are symptomatic people.
Yes.
Well, I think that the difference is the condition of employment, right?
Yes.
So if the library is saying you have to get tested as a condition of employment, then we have to pay versus someone on their own showing symptoms and getting a test. Is that a right distinction?
If we tell them to go and get tested, we have to pay. That's what I thought.
But we're not telling them when and where. What we're telling staff is that if someone is showing symptoms, in order for them to qualify for the federal emergency paid sick leave, they have to be seeking a diagnosis. They can do that in one of two ways. They can go to their primary care physician and get a diagnosis from them, or they can use the North Shore University healthcare system, call their 800 number or go online and do their e-visit. And if they say, yes, you should get tested, then they then go to North Shore and get tested. Or if their doctor says, yes, you should go get tested, they go and do that. And that gives them access to the emergency paid sick leave. Otherwise, if they say, no, I don't feel good, but I'm not going to go get tested, I refuse to get tested, they won't qualify for that. They would either have to take their sick leave or they would have to take it unpaid if they don't have any sick leave left. Okay. And then we would not allow them back into the library until they were symptom free for 72. For some, it's complicated. There's like 10 different scenarios with flow charts. But yeah, that's like the basic overview. Does that help?
Yeah. For what it's worth, I've been told by a physician that the tests are not solid, that they give a number of positive, negative, and negative positives and things like that, that really you cannot 100% trust the tests. I'm surprised that the ALA and the ILA have not have any kind of message to libraries or suggestion to libraries.
Oh, Carlos, you and me both. ILA specifically said that they felt it wasn't their place and that they would wait for guidance from the Illinois State Library. And ALA has just been saying that each library situation is unique to them and that they couldn't hope to offer guidance.
Okay, are we paying for those?
We have an institutional membership to the Illinois Library Association. Yes.
Maybe we should reconsider that. Regarding the book tests, any results on that yet?
We were able to shorten the quarantine from 7 days to 3 as a result of the first test. It was found to have negligible impact on the paperback hardcover DVD case. They're doing another round of testing right now that they hope to have the results in another couple weeks. So hopefully, they're supposed to have final results by the end of August. Yeah. The person I know that's on the studies steering committee said that she thinks that based on how things are looking and the results, the intermediary reports they're getting, that we'll probably still have to quarantine even if things are looking good, that they're probably going to still recommend sticking with the 72-hour quarantine. But yeah, so we should have final results by the end of August. We should have some more results with another set of items by the end of this month. So
finally, on the opening or partially opening, I would recommend that you get in touch with the newspapers and offer them a pre-opening tour so that they can take some photos and get the people informed.
Oh, sure.
And they can see, oh, wow, they put covers on everything and they did this and they did that. And you got to keep in mind that they have lead times of about a week. So if you're going to open, give them enough time to prepare an article with photos and everything. All right, new business, equity, diversity, inclusion. Maura, you wanted to say something about that?
Well, sort of what's next, I guess, is my question on that one.
Yeah, and so just to reflect, I just want to make sure I'm responding to the comment that you were thinking of in the patron comments, in which she said it felt a little bit like we were just making a statement and not really actively doing anything.
Right, which I know because I know the library that that's not the case. So yeah, and that hasn't been the case. But I am sort of, if you do look sort of what's down the road, what programming is in the works, or what
we probably, I'm not gonna get involved in discussing programming.
Right.
It's not our care issue. That belongs to Kate and the staff. Regarding the comments, we probably would have had that comment anyway at one point or another. I am comfortable that as a library, as an institution, we care about diversity, we care about people. We have never shown any kind of discriminating behavior of any sort. So really, I will, at this point, yes, we should do some coaching or training or have some speakers about it, but that is part of what the staff is about, and I'm not gonna tell them what to do. Any other comments on that? Agenda building. Guys, we're gonna talk about construction problems, project reopening, budget.
Could I just, I'm sorry.
EDI initiative is done, so.
Hey, Carlos.
No.
Hey,
I was just going to mention just one thing before you move on. I'm glad that you're going to consult with an expert on this topic, because on my professional society board, we're engaged in the same discussion, and we realize we're not experts, and so we need to identify someone who is an expert to educate us. So that I just wanted to comment. I'm glad you're seeking out expertise on this topic.
Okay, any issues for the agenda building? Anything that you want to add to the parts that are there? I'm going to take the EDI initiative out because, as we discussed, it's part of the library staff to provide us with information. I don't see the point on us changing the strategic plan because we have a serious, well thought out plan, and I think that we're covering all bases at this point. Do you want to discuss the circulation renovation that we're planning and when that is going to happen? Kate, you had a time frame at one point, but I'm not sure that that is valid anymore. Because we seem to be pushing everything farther back and back and back. Not because we want it, but because that's one of the realities of today.
So we do have updated drawings to share with the board and to discuss next steps. And this was kind of August was when we said we were going to bring this back to the table for the board to talk about again, along with looking at where we're at with the budget from when we looked at it a few months ago when this all started. So we were going to just kind of do that review in August so that if we do keep moving forward with the renovation, we can, if we can have the board look at it in August, it will allow us to stay on that timeline if possible.
I know you want to keep it on the timeline, but at this point, correct me, you guys, if you think I'm wrong, but I see our country and our situation being kind of slowly moving to nowhere, and we are going to be in this for the long haul. We thought that we'll be out by November. We thought that Christmas is going to be back and we're going to be shopping and so forth and so on. we don't even have any idea when the very first vaccine is going to be available, let alone production quantities that will allow us to do anything. So to plan renovations at this point is kind of premature and futile. We can discuss it, we can see it, but what's the point?
Just to sort of, and this isn't, I'm just going to sort of play not devil's advocate, but one of the benefits to doing it sooner rather than later is that you take advantage of possibly more competitive pricing, and that you have less patrons in the building that you have to work around. But I'm also very sensitive to the fact that we don't want to look like we're being financially frivolous during this time.
That was one of the comments on the from the patrons. The issue is, if we have a circulation renovation and we are still in this situation, then all of those plans to have a desk here and a shelf there are going to be for nothing, because those things will have to be changed, and to do a renovation, and then have to cover it with, I'm not sure. I'm struggling with this.
Well, Carlos, I will say that the drawings that we've adapted we've looked at them through a social distancing lens as well. So it might be helpful for the board to look at that in August and just see the changes that have been made that would account for that. It actually ties in really closely with like the measures that we have to take. Like, we've made a lot of temporary measures, but these would allow us to both create a welcoming environment while also maintaining proper safety protocols in a more long-term basis.
Let's look at them, but we're in a flux situation at this point that one of the things that Jay scared me was the comment from the Northbrook Bank that we may be seeing people not paying their mortgages and seeing closures, and that goes our real estate levy.
To your point, Carlos, as far as how long this is going to last, I mean, Zeke Emanuel has said that this could go until November of next year, 2021. So yeah, I mean, this is going to be probably another 18 months.
Yeah.
So
who said that? I'm sorry, Kate.
Zeke Emanuel, who's a physician ethicist. He's, I mean, been very involved in kind of messaging out public health issues. But yeah, so it's going to, I mean, this is not going to get resolved in the next, and it'll probably take 18 months before we get a vaccine, as you mentioned.
But 18 months from now, or 18 months from when it started? I guess that's not that much different.
Yeah, it's 18 months from now.
I mean, I think the most optimistic timeline would be like a year from now.
Right.
I would be very surprised. I mean, they're already working warp speed as it is, so I'd be very surprised if they'd have vaccines ready to go before spring, summer of next year.
And I just think that the economic downturn is, ahead of us. I think that people aren't necessarily feeling it today, but, the unemployment and, we're going to continue to see that worsen. We're going to, the real estate market, it hasn't even really begun to get hit. So I'm really leery, and Carlo and Kate and Anna, I just, it is going on longer from, vaccine standpoint, but I think from an economic downturn, we're all lucky to a point to be working, but there are many people who are collecting unemployment now, but that's going to go away. That's my concern, is sort of the lagging effect that we're seeing today. And I just really want to be conscientious of that, because, like another year, are we, what is going to happen? Retail is done. Malls are done. Strip mall's done. You know, what is it going to be? What is Northbrook going to look like? I know Leonard's is gone. I know, you know, that whole strip mall where the grocery store used to be and the Goodwill is. Like, this revitalization is just, it's going to be a lot slower if it happens at all.
We have 32 million people in unemployment at this point. And the fact that we bonded or we issue a bond to do this construction doesn't mean that we are obliged to do it.
And so all of these are good points. I would just recommend that we still leave it on the agenda so that we can have a more full discussion with information to back it up next month.
Guys, what do you think?
Can I ask one question, and this may sound ignorant, but I'm going to ask it anyway. What happens to the funds if they're not used?
I'm not sure. Anna, do you know?
I mean, I may not be asking that question correctly, but
well,
like arbitrage.
The funds, yeah, we might. The way that Jeff Rhodes explained it to me was, if funds aren't used within a certain amount of time, we might go into arbitrage. And the whole point of getting these bond funds is not to invest them to make money. So that's what the arbitrage is trying to discourage, so that you don't like take out loans to. So there might be a fee involved, but it's not like they're going to take the funds away from us. The funds are ours. But we might have to pay fees along the way if we ever got into that situation.
Okay. So it's sort of like, yeah, it doesn't get any interest, but it doesn't, and if we lose money, it would be minimal. Okay.
We do get interest on it because we have it in an interest-bearing account.
Okay.
Yes, we're making money. Well, I shouldn't say we're making money. We are earning interest on the funds.
Okay.
But I don't think the interest is greater than the interest we're paying. So, I mean, that's where the arbitrage calculation comes in.
Okay. All right.
And one thing I am unclear of is whether or not we can actually just return the money that we have received. I know Carlos has said he thinks we haven't asked or how that would work once we've taken out bonds.
We need clarification on that, Anna. Go ahead, Jay.
Like paying back, I'm just saying not returning the funds. You're asking to pay back the loan early. So basically to return it so that you could pay back the loan.
Yep. Jay.
Carlos, I was just going to ask if Anna can at least have an answer for us on the time period that we're supposed to be using it in next month. Because it sounds more like we're talking about deferral and not terminating the project. So if we're talking about, next month, probably looking to say, okay, if we can't do it this year, maybe that's something that's put in the agenda for next year, and knowing whether or not that is within a time frame and the parameter of the bond requirements would be helpful.
Jeff has told me like it's like a 24-month window from when you receive the fund.
Okay, so 2 years then.
Yes.
So if we were to say this fiscal year is not the year to do it, but we want to revisit the issue, next May, then it would still be within a time period, and that would be, I think, a reasonable course of action if perhaps we discuss it next month.
Let's look at it next month.
I guess what I would like to know at the end of the next month is sort of, if we do postpone it, why we're doing it, because we're not saving the library any money by postponing it, and we're not saving the taxpayers any money by postponing it, correct?
Right.
Okay.
The thing is, if we go ahead a year from now and do it, and this COVID continues for 3 years, then we have to redo whatever we were planning. And that's my concern. I really don't know when we say now 18 months, a year to 18 months. I don't know what they're gonna say by December, and I'm not sure that we will be saving money by contracting now. People will be starving for work a year from now.
I'm hearing two different things. It sounds like Carla's saying that if we do something, it's not going to be responsive to the current crisis. But what you're saying, Kate, is that plans have built in them. It's trying to be responsive to all of these new parameters of physical distancing, right?
Mm-hmm. Absolutely.
Okay.
As specified currently. We still do not know what the parameters will be. Actually, we don't even know what the parameters are now because ALA doesn't say anything, ILA doesn't say, the Cook County doesn't say, only the state, and we are following the state, but we don't really know why it's gonna be.
So part of what we're building in though provides the self-checkouts and things where you're saying that because we don't know what the future is, we don't know what to plan for. But I mean, the truth is that not every library is going to be able to reconfigure. I mean, most are not. So the one thing that we have put in is actually relevant to this crisis. And I'm not making any comment either way, but I guess I'm just wondering, that's always kind of true, right? Whenever you invest, you don't necessarily know.
Yeah, but maybe I should explain it this way. If I knew what color was the light at the end of the tunnel, then I know how to get there. But at this point, we don't even know if there is a light at the end of the tunnel for a year, 18 months, 2 years. We don't know, and we don't know what color it is. So that's the issue. We can see the plans, but can we approve those plans? I'm not sure that I can.
I think it would also possibly be helpful to talk about some of the changes and retrofitting we've had to do to our current setup during the last month and a half to 2 months, and just to discuss things like for return checking in items. For instance, we've had to basically bring in staff from multiple departments for several weeks to just keep up with the volume of returns that we receive. So in some ways, our current setup creates conditions where we have to rely on numbers of people to keep basic library functions afloat. And we're having to put people into rooms together to check in materials instead of just having a machine do it. So, I mean, I think, there's lots of kind of big, heavy kind of metaphysical questions that you're raising and we're wrestling with. But there's also, I guess, just some of the operational realities of, the desk, our desk spacing and the circulation desk. Like, there's a lot of staff that are kind of behind the desk, and they're all kind of forced to be behind and next to each other. And there's, I think, if you kind of were to see the library in person, you would kind of see how piecemeal things are right now, and how it has been very difficult to make things work with the way things currently exist. So and again, I know that's a very small point, but I think it would be worth kind of, maybe we should share some pictures. Once we're going to get some pictures on Monday when we reopen, just so I think you have a better idea of kind of what the experience is for staff right now.
Okay.
That's an excellent point.
If there are no more comments, then I will call for an adjournment. I need a motion.
I'll move.
Second.
To adjourn.
Kahan, second.
Yep.
Roll call, Jennifer, please.
Ms. Bernstein,
Yes.
Ms. Christian,
Yes.
Mr. Globinger,
Yes.
Mr. Parsi,
Yes.
Ms. Shu,
He's busy.
Ms. Young.
Said yes.
Yeah.
Sorry.
Thank you.
Yeah.
Mr. Fromm.
Yes. Thank you, guys. Be safe. Be healthy. Stay away from everybody.
Thank you. Bye.
Good
Is
night.
anybody going to the library next week?